Good evening. I'm Gracelyn Guyol, and welcome to Restoring Kids' Health Holistically. This evening, I'm delighted to have an expert with me, Dr. John McGonigle, who's a medical doctor, and one of the things of interest to him is homeopathy, so he's going to address that. Dr. McGonigle received his MD degree from SUNY Stonebrook in 2006. He finished his postgraduate residency in family medicine at Brown Medical School in 2009, and he's board certified in family medicine. He studied homeopathy at the New York School of Homeopathy and completed intensive seminars with leaders in the field. Before medical school, he lived for many years in Europe and in the Middle East and has published several books of poetry. Married with 3 young children, he has a private integrative family medicine practice in Providence, Rhode Island, and he sees people ranging from newborns to the elderly. He's also a clinical instructor in family medicine at the Warren Albert School of Medicine at Brown University. Welcome. Thank you so much for agreeing to come and talk with us.
Thanks for having me, Gracelyn. It's really an honor.
I think what we want to start with is the basics. Please tell our audience, what is homeopathy?
Well, homeopathy is a system of medicine that was developed in Germany at the end of the 18th century, in the 1790s, by a man named Samuel Hahnemann. Hahnemann actually was the one who coined the terms homeopathy, osteopathy, and allopathy, which is what my degree, the
conventional
MD degree,
medicine
conventional
is called.
medicine. And homeopathy, homo, like, pathy, illness, so like cures like, similia similibus curantur, which is a sentiment in medicine that goes all the way back to Hippocrates, and perhaps even further back than that, but we have no written record.
Explain like cures like.
Well,
a
that's
little bit more.
that's kind of the whole trick to homeopathy in a way. Homeopathic medicine, the best example I can give of that in its application is if you can think of something that we all use in the kitchen frequently, which causes runny eyes, sneezing, stinging in the eyes, perhaps a postnasal drip, something in the back of your throat, onions, right?
Right.
So in homeopathy, that's allium cepa.
Okay.
And frequently, especially this time of year, you know, as we transition from winter into spring and there's a lot of pollen in the air, and I have a lot of people who come to my practice who are like, they have a slightly sore throat, they're sneezing a lot, their eyes are red, they're burning. Well, you give allium cepa, and frequently it works tremendously well. So the idea behind it, why and how it works, who knows? Honestly, there's a lot of speculation. There's a lot of people trying to come up with a justification from a biochemical and a biophysical perspective as to why like would cure like, as opposed to something else. But the idea is that substances that can, goes back to Hahnemann, and it's an idea which is still held as a tenet, cornerstone of homeopathy by contemporary homeopaths, is that a substance which can cause symptoms in the crude dose, i.e. the onion that you're slicing, in a minute dose, it will actually cure it, as instanced by the allium cepa. I think I can shed even a little bit more light on that by telling you about how Hahnemann himself arrived at this idea. He did not start from a concept and then apply it. He had an experience, and then he sort of stepped back and looked at it himself and said, what does this mean? This is kind of odd. So he was trained in the medicine of the time, again, 1770s, 1780s. In conventional medicine, which at that time consisted of basically bloodletting, mercury, application of leeches, induction of vomiting, trying to get people to vomit, trying to get them to have, diarrhea, because the idea was that the bad thing was in the body, and you had to get the bad humors out. You had to purge them out.
Right.
And for instance, George Washington, who had a pneumonia, they took almost half the blood out of his body in trying to treat him because they kept using the lancet and bleeding him. And it's most likely that he died from severe acute blood loss. So Hahnemann said, I don't want anything to do with this kind of medicine. This is too brutal. I do not want to do this. So he was a very extraordinarily well-educated man, even for his time. I think he knew almost 10 languages. So he set himself up as a translator of medical texts, and that's how he was living and supporting his family. Well, there was a treatise, a book, written by a Scottish physician named Cullen, where he was talking about cinchona bark, which is where we derive quinine from, and its utilization in the treatment of malaria. And Cullen was speculating that the reason why the cinchona bark worked to treat malaria was because it balanced these humors, and it did this, and it caused dryness where there was moisture, and it brought moisture in where there was dryness. And Hahnemann said, this doesn't make any sense to me. So what he did next is one of those completely irrational decisions that history, certainly the progress of history, is punctuated by. And Hahnemann decided, I'm going to take this cinchona bark and see what it does. Well, lo and behold, he takes the cinchona bark over several weeks, and he ends up getting these fevers and sweats and pain in the joints and chills and shakes every 2 or 3 days or so. So he discovered that in some way he actually created a malarial type illness in himself by taking a lot of this cinchona bark. So that made him go, maybe the reason why cinchona bark cures malaria is because it can actually cause malaria, and so that somehow there's a neutralization of the malarial disease by the cinchona bark. We have to always keep in mind when we're talking about these things that though it's only 200 years ago, which is not really in the span of history a very long time at all, they had no knowledge of bacteria, viruses, biochemistry, physiology. The circulation of the heart had only been discovered about 100 years beforehand. So
it's purely observation and trial and error, basically.
Completely, yeah, empirical they would call it. Where you do not start with a hypothesis and apply it. You have an objective awareness and perception of the facts, of the data, and then you try to derive some sort of conclusion from that.
Okay. Well, then I want to jump those 200 years and come forward, because what I appreciate the history, because what it told me when I first became aware of homeopathy is that this was something that has evolved being used for a very long time, and nobody really even today understands exactly how it works scientifically.
Right.
But the observation has been clear, and it's been that it does work.
Right, absolutely, it does work.
For 200 years, and I'd say that's a pretty long clinical trial.
Yeah, for 200 years in multiple societies and multiple cultures.
Different cultures.
Yeah.
And it was one of the dominant medical treatments in this country until the turn of the century, when antibiotics became the new exciting thing and pills took off.
Right. That would have been with the report in around 1914 where they decided that a lot of the homeopathic medical schools did not pay enough attention to biochemistry, anatomy, and whatnot, and so they essentially pulled the accreditation. What in today's terms would be pull the accreditation of the medical schools, and they started to die off. Boston University Medical School was a homeopathic medical school until 1938. Roger Williams Hospital up in Providence, not far from here where I practice, was the homeopathic hospital of Rhode Island until 1941. So homeopathy actually has a very long-standing history, and as you said, in this country, at the turn of the 19th, 20th century in 1900, about 25% of MDs in the U.S. were homeopathic doctors.
And so, but what happened is, in the U.S., we took a turn into a different kind of medicine, a pharmaceutical model.
Right.
That was not followed in other countries because it was too expensive.
Right.
So homeopathy is still, all of these years that we've been doing the pill path, has been one of the biggest treatments in Europe and in lesser, poorer countries.
Right.
Because it's easy.
Yep.
It's effective,
Yep.
and it's not terribly expensive.
It's actually, I mean, relative to certain medicines, it's incredibly cheap. I have a patient in my practice who recently has undergone treatment for hepatitis C with conventional medicines, and the medicines cost $60,000 a month. They cost $2,000 a day.
Wow.
So, I mean, medicine
Yes.
can, not all medicine obviously
Right,
is that
but
expensive. Medicine can be like spectacularly expensive. And homeopathy, you know, a good 2 or 3 week treatment of homeopathy would cost you no more than $5 or $6.
For hepatitis C?
No, not
Okay.
for hepatitis C. I think for hepatitis C you'd want to do a bunch of different things. I think that at this point in time, we don't use strictly homeopathy to treat something like hepatitis C because we understand the science of it so well. Now, what I will do and other people of my ilk will do is we'll treat conjunctively or alongside the conventional treatment with homeopathic treatments to both alleviate the side effects from the drugs that are being used and also to try to, you know, increase the effectiveness of the drugs that are being used. But in places like India and in South America where homeopathy is very big, they will use it just to treat something even as severe and extreme as hepatitis C, as well as, you know, cancers and high blood pressure and whatnot, stuff like that.
Okay. So, well, we've segued into a little bit about the U.S., but give us some idea of the scope of homeopathy in this country now.
In the U.S. now, I would say homeopathy is, if you consider conventional medicine being, you know, the number one, the most commonly used treatment in the country, folk medicine casting the net very widely, anything from, you know, grandma's suggestion that you use apple cider vinegar for an upset stomach, or even a mom, you know, kissing, you know, the knee of a child who's fallen and skinned the knee, and lo and behold, the knee feels better. I mean, you could call folk medicine, you know, very very widely. Homeopathy as a adjunctive treatment, as a sort of like in addition to other things treatment, is right up there, along with, you know, herbs and supplements.
Herbal medicine, supplements, and so complementary and alternative medicine.
Right.
And homeopathy is a really big part of that.
It's a very big part of that. And then, of course, you can take it out further where homeopathic medicine is felt to be a coherent and cohesive system of medicine in its own right.
On its own.
Yeah, so that you would pretty much exclusively use homeopathy for treating not only the aches and pains of everyday life, but also things as, you know, severe as, you know, strokes, heart attacks, high blood pressure, diabetes, things like that.
Okay.
So, but a lot of people, a lot of these things, a lot of times, and I fully applaud this, a lot of times people will go into their local health food store, and the folks that, you know, work in the majority of these health food stores, they know an awful lot. And so they'll go into the health food store and say, you know, I got this, you know, my doctor says I got diabetes, and, you know, my eyes, I'm worried about. So they'll say, you know, here, take some lysine and try this homeopathic. And so it's sort of like part of this large.
Because it's not dangerous for the most part.
It's not dangerous. You know, if you're going to take homeopathy really seriously, anything that is effective has the potential to be dangerous. It's the nature of the world that we live in. But you would have to take an enormous amount of homeopathics over a very long period of time, and the potential danger would be you would start to what we call prove it. Prove, which comes from the German proofing, which means that once you take a substance repeatedly, as Hahnemann did with his experiment with the quinine bark, he will start to show, he will start to express the symptoms. That, I mean, that you'd have to, you know, pretty much overdose on homeopathy for weeks and weeks.
And it's very unlikely.
Right.
But,
and the real consideration is that people will go to a homeopath or an unlicensed provider, or even a licensed provider, let's say, and they'll take homeopathy instead of doing something else, and they may not be treating something which could effectively be treated in a conventional way. Now, that, of course, is a real possibility. That being said, my colleagues in the conventional medical world, who I have, by and large, tremendous respect for, iatrogenic, physician-caused illness is the 4th leading cause of death in the United States, according to the last report of the Institute of Medicine.
Right.
So we can all say that, if you use homeopathy, you could miss something else. But you know what? There ain't no free rides in this world. And going to a conventional thing does not mean everybody skips down the path of the primrose path.
Everybody gets well. That's
right.
That's not the way it goes either.
Not the way it works.
Okay, so let's go from the history and some of the background to how do you use this in your practice?
In my practice.
And since we're talking about children, let's
Right.
focus on children.
Right. Well, the great thing with children is the what is known in homeopathy as the infinitesimal dose. So that on the one hand, people will say, again, from a more conventional standpoint, it's bogus. There's nothing in homeopathy. There's nothing there. It's as Abraham Lincoln put it. It's like trying to fertilize a field with a fart. So that's how he described, in his inimically Lincoln-esque type way. But there's nothing, quote unquote, in the homeopathic.
So highly diluted.
It's so highly diluted.
And that's why there's been a lot of controversy.
Tremendous controversy.
Because
then it makes from a mechanical, mechanistic, statistical, mathematical perspective, which by and large is the world in which we live or find ourselves. It makes no sense that homeopathy could have an action. And let me say for 1 second, and then I'll return to why that makes it particularly good in children. Hahnemann, if we go back to the story of him taking the quinine bark, again, keeping in mind that at that time he saw like large amounts of this medicine was used, and they would cause more harm than help. And so what he did is he took the quinine bark and he diluted it. He cut it in half, and then he cut it in half, and then he cut it in half, and then he used it in people who had malarial type illnesses in the area, in and around the swamps of the place he lived in Germany, and he found it was still effective. So he just kept diluting it without realizing, because they did not have the biochemical and physics knowledge that we have now, nothing near it, without realizing that he was diluting it beyond what's called Avogadro's number, diluting it into the absurd place. He was just trying to seeking out the most effective, least potentially harmful medicine because of the time in which he lived.
Right.
Well, lo and behold, as we know more as the 19th century progresses, the 20th century progresses, homeopathy therefore becomes, absurd because there's actually nothing in it. But that's not what Hahnemann was pursuing initially.
And so do you consider, it seems to be speculated that that this is actually an energy medicine, and so that there is an imprint of the plant left even when there's not a trace of the plant in it, in the waters that it was created from.
That's very true, and they've actually done what's called mass spectroscopy, which is a very, very sophisticated form of MRI that's used to study matter at the atomic and subatomic level, and things, quote unquote, leave this sort of like trace, imprint. And if you take, homeopathic remedies are generally imprinted, mixed together with milk sugar, and so you may take a plant, let's say our Allium cepa friend, you take that, you mix it with milk sugar, you dilute it, you have a homeopathic remedy, and then you have another batch of milk sugar that you've done nothing to. Well, the two things should be identical because now there's nothing, quote unquote, in the Allium cepa infused milk sugar. Well, when they do the mass spectroscopy, there is a difference between them.
Okay.
There's no
so it still shows.
It still shows.
Yeah.
But again, it flies in the face of mechanistic, conventional thinking, and so it's absurd. Therefore, ipso facto, it cannot work, despite the fact that it does.
Well, and that was how people viewed acupuncture in this country until about 30 years ago. So we, as brilliant as we think we are, we still don't know everything.
Right, right, absolutely.
So let's go and talk about the application. How do you use this?
So let's return to the children.
Yeah.
So the fact that it is so dilute and non-toxic, you can use it with children, and you're not going to get, say, using antibiotics, you get diarrhea from antibiotic-associated diarrhea, or you get rashes, or you get an allergic reaction. So you know that you're not going to have any side effects.
They're much more. Their systems are less developed and much more sensitive
They're
than
much more
the
sensitive,
adult.
and so therefore and I entirely agree with you that it is, a form of energy medicine. Again, which sort of begs the question, what does that mean, energy? We both know what it means, but what does it mean in a practical way? I'm not really sure.
It means that science can't figure it out yet, and so that's what we call it.
Yeah, yeah. That's about as good an explanation for it I ever heard.
Because we know it works. We can tell like Hahnemann, we can observe that
Right.
it does have an impact, and it's been used for so many years that there's no doubt that it works.
Right.
But nobody can explain it yet.
Right.
And so
Right.
so you
So let me answer your question. I tend to go off on these digressions. So you use it in children. You can use it, for instance, in a case of a 3-week-old child who is not feeding well or is not sleeping well. I mean, even a conventional physician is not in a million years going to want to give a pharmaceutical drug to a 3-week-old infant. I mean, there's no way, right? So you can give it to the child because it's milk sugar. Children actually like to take it,
Right.
which is
That helps
for those of us
at
who have
every
children or raise
age.
children. That
Right,
helps, right?
right.
It because they're so sensitive, because they're still so close. Again, in an unscientific way, but this is my belief, because they're still close to that other side, to that great energy that we all emerge
Come
from,
from.
manifest, and then return to. Because they're still so close to that, they tend to respond very quickly and very effectively to homeopathy, which, incidentally, is one of the reasons to claim that something like homeopathy is not merely the placebo effect, because the little 2-week-old, 2-month-old child has no idea that you're trying, no expectation, and
Right.
it also is used, in veterinary homeopathic
Yes,
medicine.
it works for animals,
So-
and they also don't have any belief systems that we know of.
Exactly, exactly.
So, okay, so
So
let's
you can use it in those acute things, and then you can also use it for more chronic.
Well, what are
issues.
some of the customary things that you use it for in children?
So early childhood, use it by infancy. I mean, breastfeeding problems, colic, right? Sleep issues, sleep problems, rashes. There are a lot of rashes that children seem to get the first few months of life. They'll get the infant acne, they'll get the cradle cap, they might get a little ringworm.
This helps clear that up?
It helps very much clear that up.
And talk a little bit about sleep issues, because that's a big one in children and adults, but let's talk about the child.
Right. Well, sleep issues are a big deal, and I don't presume to have the answer to infant, sleep issues. If I did, I'd have, a penthouse apartment on Fifth Avenue, because I mean that's almost $1 million question in, early childhood. But what it can do is it can seem to soothe the overall nervous system of the infant, let's say up to 6 months or so in this case, and can help increase the security of the infant-mother bond, and can help with the nursing and the breastfeeding.
So calming.
So calming, and also nutrifying,
Bonding.
because a full belly is in many ways the best inducement to a
For
good
sleep, right.
So once you work together with the mom and the infant in that way, and I will say that, being a family doctor, I'm in the privileged position of treating in a situation like that, both the mother and the infant.
Right.
So that, I can give the mom homeopathy, the baby can get the homeopathic remedy through the breast milk, as well as treating the infant.
Okay.
So.
Okay. So that's great, because lots of times if you have a calm mom, you have a calmer baby.
I'm very fond of saying "happy mommy, happy baby."
Right.
So when you treat these things, oftentimes, for instance, treating infant sleep difficulties, sleep struggles, frequently is a matter of baby wants to be up and be smiling and be happy from 1 to 5 a.m. and wants to sleep from 1 to 5 p.m. Right. So everything.
Right.
So what we have to do, what homeopathy helps do, is it attunes people to their own body and their own situation and their own health, their own best health. So frequently, what's going on is not necessarily like, voila, magic, all the problems go away. But there's all of a sudden an understanding of different ways of dealing with the problem, so that, you know, if little Janie wants to be up from 1 to 5, well, maybe mommy's up from 1 to 5 too, and then she herself
They both
will
nap.
sleep
Yeah.
from 1 to 5 in the afternoon.
Yeah.
You know, there's many ways to arrive at healing, and that's one of the things I find so attractive about homeopathy, because what it does is it sets in motion a healing response on the part of the individual, and on the part of the individual within the context that they live in this case within the family unit, which in early childhood is basically like the mom and the baby, right? I mean, dad's like, he's important, but he's kind of peripheral to that.
Right.
So what happens is healing responses happen. It's not so directly controlled, which is more the case in a conventional medicine, where you are directly trying to treat. I, Dr. McGonigle, will treat symptom X in Gracelyn by doing therapy B. You know, it's not so controlled like that. What you're trying to do is set up a stage where healing can happen, and homeopathy really helps set that stage.
And it tends to work gradually some of the time, and pretty quickly some of the time.
Yeah.
Can you predict that, or is it per the individual, or depending on the condition?
I would say predominantly based on the individual, so that I know a child who has responded rapidly to homeopathy in the past will probably respond rapidly now, but also in the intensity of the you know, situation. So if a child, which will happen not unusually, we all know who have children and work with children, a kid can be completely fine at 2 o'clock in the afternoon, and by 3:15 can have 103 temperature. And it just like shoots up, you know. That, for instance, is a fever that's going to respond very, very well and rapidly to belladonna, homeopathic belladonna. The hallmark of which is a very rapid and sort of violent movement from seeming health to like drastic illness, you know.
So you'd use that instead of aspirin?
Absolutely, yeah.
And so that's interesting. I was not aware of that.
Yeah, belladonna tends to work very well in situations like that.
And so what are some of the other situations we've talked about infants, but let's move up to 3, 4, 5, 8 years old. What goes on in those ages that you would treat with homeopathy?
Well, you could treat, you know, you continue through childhood, of course, to treat the hallmark of it is of any sort of pediatric treatment, in this case homeopathic, is acute illness and trauma. Now, you know, hopefully, knock on wood, I'm not talking about terrible trauma, but, you know, falls off the swing, twists the ankle, you know, maybe playing with his brother, and the brother, you know, hits him in the leg. With,
or in a car accident.
Or in a car accident, you know, so, right, exactly. So there's that, and then there's the acute illnesses, you know, the bronchitises, the sinus infections, the ear infections, the diarrheas, whooping cough. For the past week up in Providence, probably down in this way too, there's been a pretty bad stomach virus going around, a lot of abdominal pain, a lot of kids having diarrhea, fever sort of comes and goes. So you know, those are the cornerstones of what you do. But then you also start to see behavioral things, and you start to see eczema. You start to see not just, you know, an ear infection once a year, but you start to see recurrent ear infection. A lot of times parents will bring their child to me because the child is, say, 3 or 4 years old, has had 5 or 6 ear infections in the previous 18 months. The surgeon, the ear, nose, and throat surgeon, is talking about putting in tubes or maybe taking out the tonsils or the adenoids. The parents say, isn't there another option? Isn't there something else we can do? So that's more of a chronic situation. And then as you move, you know, even further into like 4, 5, 6, then you get into, you know, asthma. Can be, you know, is often an issue, and homeopathy will work really well in situations
with
like
all
that.
of those.
Oh yeah, oh yeah. You know, I mean, there's no one thing that answers you know, all eventualities.
Right.
But and perhaps to a large extent, the people who come to see me, you know, with
wanting
and having a sort of holistic perspective to begin with. So you know, it's definitely a certain patient population that I see.
Sure.
Though it spans socioeconomic and education, you know, classes.
Yeah, it's a mindset within an individual or a family unit.
Exactly, and those are people who are willing to
My
make,
mindset.
and it's my mindset as well, both as a man, a doctor, and as a dad. And it's people who are willing to make changes. You know,
Right.
It's not just here's the pill and everything's. I mean, that's the culture that we live in, right? I want it now. I want it today, and I don't want to have to do any work to get it.
Right.
And that's where you get pharmaceuticals. That's where
Right,
they come
that's
in.
when they get the prescription. But for those of us who do not want to use the prescription because of all the side effects or the interactions between various prescriptions, homeopathy is really a wonderful option.
Yes, and over time, what happens too, especially with the acute illnesses, is, you know, I learn the child, the family learns me, and the parents start to learn about homeopathy. It's one of the things that made it so successful in the 19th century, and I think is bringing it back now in the late 20th, or, you know, our current century, is that the parents start to understand, oh, fever has gone up really high, let's give belladonna. Oh, sneezing, water, runny eyes, whatnot, let's give Allium cepa. So it empowers families to take care of their children, because they don't need to be calling me all the time, because I'm the one who holds the magic box of the prescription pill.
Right, and that's where reducing healthcare costs would come in if more people were using some of these simpler things and safer things and less expensive things.
Absolutely.
So that's why I was so excited to have you come on and talk about it. I want to talk about some of the more challenging, you touched on it when you said they work on behavioral issues. Let's talk about children's mental states and how you can use homeopathy for treating childhood mental disorders.
Well, you know, there are struggles that all children have, that all of us human beings have. You know, even as we get older, right? We continue to be confronted by emotional and spiritual challenges that we need to try to assimilate into our experience and our knowledge and our memory, and somehow grow from and move forward. Imagine, therefore, what it is for, you know, a 2, 3, 4, 5-year-old child who's confronted with, you know, just bombarded with challenges on a, you know, hour by hour basis
that they have no way to understand,
and yet they yet they have to come to some sort of understanding. That's where they look to their parents, obviously, but also to their peers. One of the things that homeopathy is able to do, and there's a man named Harry van der Zee, who's a physician in the Netherlands. He's done a lot of work on this. Is homeopathy can actually attempt to address in a concrete way things that, I mean, where does childhood start? Childhood starts at conception.
Right.
I'm not making any suggestions about, you know, when the fetus is viable or anything like that, right? This is a political, my politics are mine, your politics are yours, okay?
Right.
But, you know, life, quote unquote, starts at that time. And so what experience the mother had of her own pregnancy, within her relationship, within herself, over the course of her pregnancy, is a crucial part of trying to understand and tease out what are the crucial elements in a child, let's say, who's 2.5 years old and just won't stop biting his preschool classmates.
Right.
I mean, everybody's going to bite somebody at some time in
Once,
their life,
but
right? I mean, that's
every
normal,
week.
but not every week, and not over and over, and not when they see what the ramifications are, which is, you know, you need time out, you can't go to snack, all that stuff.
Right.
So what you do homeopathically is you start to try to understand, you know, how these issues have expressed themselves over the course of the pregnancy, perhaps even in previous generations. Perhaps there's a certain amount of violence or abuse or dysfunction, or, I mean, we all have, you know, dysfunction in our lives and in our families, but, you know, there are levels which are truly destructive that you can see, you know, traced from generation to generation. So you try to tease that stuff out, and then you try to apply what is known as a homeopathic constitutional remedy to the child, and that is what is trying to picture the patient, in this case the young child, as a whole, so that you're not trying to treat, say, the behavior, say the biting.
The one thing, you're treating the system.
You're treating the system. You're trusting that the organism and the spirit that has manifested in that organism is going to respond in a healthy way if given the opportunity. So you try to, you talk to the parents, you talk to the teachers, you try to get the child to, stop doing certain things. Maybe you look into food allergies, maybe you look into bedtime, maybe the kid's tired, right? I mean, you don't just give the homeopathic remedy. But then what you try to do is you try to give the homeopathic constitutional, which matches all of the symptoms. So then it becomes a much more sophisticated exercise as a homeopath, because like I said before with the Allium cepa, the runny eyes, the sneezing, the sore throat, now you're trying to actually treat a human being. You're not just treating a spring cough. So you want to know about the pregnancy, you want to know about the mom's health, the dad's health, you want to know about the health the first year of life, you want to know likes and dislikes, you want to know what foods the child really craves, what foods the child is really averse to or doesn't like. You want to know how the child sleeps, what time the child goes to sleep. You want to know anything that we consider in homeopathy, strange, rare, and peculiar. You want to know things that individualize that person.
Make that person unique.
Unique. And then you try to find the substance which has been found over the 200 plus years of homeopathic clinical use worldwide. You try to find the substance which has been found, lo and behold, to be effective in children who only sleep on their right side, hate ice cream, but love green beans, right? I mean, that would be that for a homeopath. That would be a very valuable piece of information because it's so weird.
You do an extensive interview. I mean, that's where you start.
Right. It's about 90 minutes. My first consultation.
And that's what you're looking for. And do you videotape that, or do you take notes, or how do you handle that?
I take notes, and I listen. I basically I ask the parents, what's going on. Tell me about the child. Tell me about your pregnancy. Tell me about how do you two get along. Assuming that there's two parents, or perhaps it's not. And I just sort of let come to me what comes to me, and then I'll ask more questions. Like I said, what sort of foods does little Jimmy like? What time does little Betty go to sleep and stuff like that. And I'd like to have the child there. I try to keep things on the down low, shall we say, in terms of not wanting to make the child feel bad who's over in the corner playing with things, because it's not necessarily a pathological situation. No. But I like to sort of see the child, observe the child, because children can't, as we know, they have a very hard time expressing, where they're feeling and what they're feeling, because they don't really know. They're sort of floating in this. It's all new. Yeah, they're like in this river. They're like in this little raft that's going down this river, and they're like, I don't know where I am. Right.
And you don't know what you don't know until you somehow figure it out, and then that's retrospective.
Which is frequently like by stubbing your toe repeatedly, and then you finally figure it out.
Right. Okay. So. So then what happens? So you do an intake, and I know it would be different, because if they have obvious symptoms, you probably would go to the symptoms. But for this systemic approach, or the whole approach, that would be more for behavioral.
Right. Well, I have something here, actually.
Okay.
Allow me to show you.
Sure.
Because this is a good short example of it. This is a book by an Australian homeopath named
Let's
Peter.
Get a close-up on your camera.
Peter Tuminello, The Child's Mind and Behavior. And this will have the different symptoms that have been seen in children, both physically.
Oh, you want to hold it up again?
There we go.
Get a close-up of it.
So this has the child's physical appearance.
He's going to come back.
As well as the mind and behavior of the child and sleep patterns.
Okay, we could just sit it here, maybe. Get a close-up of it. So repeat the author's name again.
Peter Tuminello, who's a homeopath in Australia.
Okay. There it is.
There we go.
All right.
And that's actually his son, cute-looking kid. He somehow looks Australian, doesn't he? So, for instance, and this is one of the this is one of the geniuses of homeopathy. How does one, if you ask yourself the question, okay, you're trying to give a substance that will set in motion a healing, curative response in someone, taking everything that they are as being an expression of who they are. Well, there's a kind of 19th century German madness inherent in that, because what do you take everything, left eye slightly more brown than right eye, how do you do that?
Yeah.
And the way it's done in homeopathy is called something called a rubric. So for instance, here under face is face asymmetrical, face bloated, face discoloration, alternates red face with paleness around lips and nose, blue face, coffee-colored face, dark
Okay,
rings.
so as a practitioner, you have to go into the minute
You have to
detail
go into the minute
in order
detail.
to find the right treatment.
Yes,
Okay,
yes.
So I don't want to this is of interest, but I don't want the viewers to have us go on about this.
No, it's just as an example of
yeah.
why in the world does it take me 90 minutes to sit with the parents of a
Right.
2.5-year-old child.
Right.
Because you're really trying to get, and so that's how you arrive at the remedy, as opposed to
Okay.
runny nose, sneezing, and whatnot.
And so then you try a remedy, select what you think is do you just use classical homeopathy with just one remedy?
Yes.
Okay.
Yes.
And as opposed to non-classical, which can use a couple or three or whatever.
Called polypharmacy. And,
Okay.
And perhaps, I'm sure, especially in France, it's using more than one remedy is very common. But the problem is, if you get a good positive response, you don't know which of the 11 substances in the remedy caused it.
Right. So by going with one, then you start from there and
Right.
you search for the one that solves it.
Right. Exactly.
Okay. And so, talk about the remedies. Are they powders? Are they liquids? Are they drops? Is there a variety?
There is a variety. They're the ones that you can get, say, at Whole Foods or your local health food store, come in these little lactose sugar pills. They're about
Put it
yay
under your
big.
tongue.
You put it under your tongue. Again, the health food store will have on hand maybe 60 homeopathic remedies. Then there are pharmacies like Hahnemann Labs in San Francisco, Helios Labs in London, Washington Labs in West Virginia. They'll have thousands of remedies available.
Okay, and
so
so
those
that would
are
be
for
where
much
the
more
practitioners
professionals.
order through those.
Right.
But for the rest of us, I use homeopathy for poison ivy.
Right. Right.
Anytime I touch a leaf, I get a little mark, and then it starts making its way through my whole system.
Right.
And
Right.
pops up everywhere. So
Right.
I race for the homeopathic treatment
Yeah.
that stops it.
Yeah. Do you use Rustox? Is that what?
I don't know. I just look at the brand,
Yeah.
and I don't know. I don't
Yeah.
even look at the
Yeah.
whatever it is. I just know which brand I've used and that it works. And so,
So homeopathic substances, so they can be in powders. I tend to use them frequently in liquids, whereas if you put the substance in a liquid, you're able to energize it a little bit more each day by doing what's called succussion. So you don't just have the pills. You put the pills in distilled water, and then you can succuss it, and then you crush it or dissolve it in the water,
Okay.
and then you can give the drop. That also can be of benefit in the particularly young child, right? Let's say 3 weeks old, where
Okay.
if you put the pill in there, you don't know what they're going to do. They may gag on it and stuff. This way, you
Yeah.
can just put the little drop.
Okay.
So homeopaths will use different things. It depends on
The situation.
the situation. Where the parents are at, whether or not they are they at the store and they're calling me and I say get something. Homeopathic remedies are made from plants. They're made from animal products, blood, feathers. Tusks. There are homeopathic spiders. There's a whole class of homeopathic remedies made from snake venom. They're made from minerals. So
yeah, I knew gold was in.
gold is
One
a
of them.
classic treatment
What is that
for.
used for?
Classically for depression.
Oh.
It's also used in certain cancer treatments. That can be very effective for depression, especially later in life, especially people in their 80s and 90s, their 9th and 10th decades of life. Homeopathic remedies can also be made from disease products. There's a homeopathic constitutional remedy made from breast cancer tissue called carcinosin, which has been used since the 1910s. It was first used in...
To prevent breast cancer?
No, to use it to treat not only cancer itself, in some cases breast cancer, but treating the underlying energy of cancer. Now, what does
Throughout
that
the
mean?
body.
Throughout the body.
Yeah, on
you
a
know,
system
so,
approach.
Yeah, exactly. So it
Okay.
can be people who perhaps, and this, of course, is speaking in a fairly superficial way, but people who can use or benefit from carcinosin are people who tend to be extremely controlled, very rigid in their thinking, and yet they feel like everything is out of control all the time. And that seems to express an underlying aspect of cancer from an energy perspective.
Because cancer comes, a lot of it is stress induced, and so
Right.
if you're in a constant state of stress, your risk is much higher
Exactly.
than if you're able to
Exactly.
be less vigilant inside.
Exactly. And cancer seems to be, again, from a certain perspective, seems to be a manifestation or an expression of complete, being completely out of control on the inside. Like on the one hand being
Yeah.
very controlled, on the other hand being completely
Trying
out
to
of
be very
control.
controlling
Right,
because you're out of control inside.
Exactly,
Okay.
exactly.
Okay.
And also from what's called the imponderables. So again, back in the 19th century, there's a lot of interest in magnetism. So we have the south pole of the magnet, the north pole of the magnet. We have moonlight, sunlight, X-ray. They've shot X-rays into milk sugar and made homeopathic remedies from that. I mean, homeopathy. You know, I fully acknowledge homeopathy can get pretty out there, but it's also fascinating.
Yes, I'm sure. As a doctor, it would be a whole field that you could explore for a long time
Yeah,
and
you could,
still
yeah.
not feel like you've quite mastered all of it.
Right.
Yeah.
But most of the time, what are called the polygraphs, or the constitutionals, which are, you know, for people who are familiar with homeopathy, I'm sure you'll recognize many of these, Lycopodium, Nux vomica, Natrum muriaticum, which is
and what are
sea
those?
salt.
Tell me what each of those
Lycopodium is a club moss that's very good for cradle cap.
Okay.
And is also good for digestive issues. Children that don't seem to digest their food very well, don't seem to assimilate their food very well. Maybe they have a lot of spit up. Maybe they tend to have, you know, stools that are kind of greenish at times. Nux vomica is from a seed in the South Pacific that has a certain amount of strychnine in it, and it was actually used in fishing by Pacific Islanders. You know, they would use it as like poison spear points.
Okay.
Keep in mind, this is homeopathy, so the substance is diluted so much time.
Diluted
You're
that
not
it's-
actually
yeah.
giving your child strychnine. I mean,
Right.
that's not what's
The
going
energy
on.
is in the water, but the substance
Right,
is
the original substance.
Yeah.
So that Nux vomica can be used for children who are having trouble behaving in school. Maybe they're very aggressive towards their classmates, tend to get, you know, stomach aches before going to school, tend to get very anxious. You know, I mean, we express, as we all know, we express our emotions and our anxiety very much within our
In the
GI tract.
digestive,
You know,
yeah.
I mean, even coming down here, driving down here today, though, you know, I'm very happy to be here. Of course, there's a certain anticipation, a certain,
Right.
you know, apprehension or anxiety.
not on TV every day. A little bit of butterflies.
Right. So you're right. That's what you feel, the butterflies. So that's
right.
what Nux vomica can be used in children for that. And then Natrum muriaticum, which is sea salt, tends to be for kids who don't seem to be able to express themselves in a really full way, and they're sort of
Closed
shy.
down.
Yeah, closed down, retiring. They don't like to be seen doing things in public. They tend to maybe get like not necessarily bullied, but maybe run over by some of their more aggressive
Because
you know,
they're so
colleagues.
introverted.
Right, exactly. And you know, phosphorus is another great remedy for kids, which is the substance, the element phosphorus. And phosphorus has been described as children or adults. Some of these things, in many ways, we apply to adults as well, as being light without heat. So those are the kids who are just like running around. They're completely energetic. They're totally great, totally fine, and then they crash. They just like fall off the edge of this table
Right,
here
right.
because they don't have sort of sustained home fires burning,
Right.
in their center. They have these like pine
Spurts of
boughs which
energy.
go up
Right.
in flames, and then they collapse down.
Right.
Phosphorus can be used for is frequently the first remedy to use and works well in children with recurrent nosebleeds or children who tend to get a lot of bruising. It can also be used in girls when they're first getting their period, and their periods are irregular, and they can cause a lot of cramping pain and whatnot.
Very painful or heavy.
Yes, exactly,
Yeah.
especially heavy. Yeah.
So, well, you've told me a lot about homeopathy that I didn't know. Let's see, what have we not covered yet? We've got a few more minutes. I'll talk about the safety, I guess. Or did we cover that pretty much?
I think we kind of covered that.
Okay,
I think
so
it's, you know, again, the important thing is you do not want to leave something that is potentially dangerous unseen by a professional who is trained in evaluating whether a situation is critically it needs to be addressed in a critical fashion or not. Mm-hmm. Now, the problem with that is that the healthcare system that we have, from a conventional perspective, is based on catastrophe. So it's almost like the French system of justice, where in our in the English system of justice, you're innocent until proven guilty. Well, under Napoleonic law, you're guilty until proven innocent. Well, if you go to the hospital, it's assumed you have severe bacterial meningitis until proven otherwise. So if you're kind of like between a rock and a hard place, if you put yourself in the hands of the conventional medical system, it's possible. There are a lot of very reasonable, very thoughtful, very commonsensical people in that conventional system, but it's also possible that you're going to end up like on the conveyor belt.
Yeah, getting more medicine than what you really need.
More medicine, and then a CAT scan, and then a spinal tap, and lo and behold, at the end of it all, it's like, well, everything's okay. So
yeah, thank you very much.
Yeah.
$10,000 later.
Yeah.
You have a couple of other books that we were going to talk about.
So this is just a very good book. Again, these are books from a professional,
Integrated
probably
Pediatrics,
professional
and this
perspective.
Is by Timothy Colbert and Karen Olness.
Yeah, and this is published under the
We're on this camera
right here. This is published
now they're back.
under the
okay, there you go.
Under the editorship of Andrew Guyol, who many people are probably aware of,
yes,
the professor out at Arizona. It's published by Oxford University Press, which is the oldest press in the world.
Okay.
But this covers everything from asthma to attention deficit disorder to pediatric Crohn's disease and things like that.
And is it written for consumers or for
No, this
practitioners?
is probably for practitioners, professionals.
Okay. All right.
This might be a good book for people who are curious about how to perhaps apply homeopathy for themselves. They could certainly then go to a practitioner and understand more about it. But this is the homeopathic treatment of children by a couple of naturopaths who actually live.
The authors here.
Paul Hersku, who's a naturopath who practices up in Longmeadow, Massachusetts, just over the border, up in northwestern Connecticut. He and his wife, Amy Rosenberg, are naturopaths and homeopaths, and they are very, very well regarded in the homeopathic and naturopathic community, with a specialty in children's homeopathy.
Okay.
And there's the National Center for Homeopathy out of Washington, D.C.
Oh.
They have a lot of stuff for consumers, parents, people who want to educate themselves, understand more about homeopathy, how they can use it in their own life. And the great thing about homeopathy is you can get a small booklet. They're out there. You get yourself a little kit, and you could treat poison ivy, right? I mean, here's the summer season.
I go by the homeopathic.
Exactly,
right.
exactly. And what I'm saying, even for parents who are watching this and are interested in sort of maybe applying or thinking about how some of these ideas and this medicine may play a role in their own life, there's all sorts of little things that you don't need to go to the doctor to, but it would be nice if you could start to treat it, right? So maybe a bruise, a sprain, a poison ivy, a bad bug bite that's getting swollen. We use Apis mellifica, which is homeopathic, homeopathically prepared bee venom, which is really effective for bug bites.
Okay,
and
wasps
swollen and wasps and things like that.
Do you have a mosquito repellent?
It's citronella.
All right, that's fair.
So I would encourage parents to consider trying this thing.
Well, I use a homeopathic, won't surprise you, but I use a holistic vet, and she uses homeopathic remedies for the animals too.
Right, absolutely.
And so it's often makes it easier.
And of course, we're both familiar with the magic homeopathic remedy, which is arnica.
Yes.
for bumps and bruises.
Right.
I mean, you want to talk about something that is going to work like that. I mean, I have all my parents when they're, when their baby is a month old, they say, listen, I need you to buy some homeopathic arnica because sometime in the next 18 months, your child is going to fall off of something and is going to have a huge thing on their head.
Right.
At that point in time, get out the arnica. And I can't tell you how many times I've heard from parents, it was amazing. They big golf ball size.
Yeah.
They give the homeopathic arnica within a minute, gone.
Wow.
It's strange.
I didn't know about that.
Yeah, it's strange, and you have to prepare. Part of you have to have it on hand.
So let's talk about what are the 5 things that parents should have on hand.
You should definitely have arnica on hand.
Okay, and is it a salve?
It's a salve and a pill.
Okay.
You should have arnica on hand. You should probably have something called. You should have lycopodium on hand.
Okay.
Lycopodium is for upset stomach, things like that. You should have belladonna on hand. Belladonna is for high fever.
Okay.
That comes on suddenly.
Instead of aspirin, you give
instead
belladonna.
Yep. And remember, we make sure not to give children aspirin. I'm sure most parents are aware of that.
You say that because not everybody knows that.
So do not give children under the age of, let's say, 10 or 12 aspirin, because it's associated with something called Reye's syndrome, which can cause catastrophic kidney failure and blood poisoning. So that's why nowadays in pediatrics, since probably the mid 90s or so, use Tylenol or Advil or Motrin.
Okay.
So if a child has a high fever that starts, you need to be in touch with somebody who's a health practitioner, or it's wise to do that. This is America, thank God. We're able to pick and choose our own, make our own health decisions.
Get some professional advice.
To have somebody there that you can lean on if you need to. Cool bath, lukewarm soak, try to bring that fever down, and try the belladonna. Try to give that also to bring the fever down. If the fever does not come down within 2, 3, 4 hours, you may need to speak to someone, have the child evaluated, use Tylenol, use Advil. So arnica, lycopodium, belladonna, Apis mellifica, which is for bug bites and bee stings. And in this part of the world, I would say Thuya and Ledum, because if you take a tick off your child, again, the threat of Lyme disease is very real in this part of the world. We're all
Yes,
aware.
it is.
We're all aware of this. You need to have somebody that you can speak to about it from a professional perspective. But Thuya and Ledum, if you take the tick off, Thuya for the injection of toxins into the body, which the tick can do, and Ledum for puncture wounds.
Okay.
So Thuya and Ledum can be very effective in helping heal.
Great to know.
Yeah.
We are out of time. So you came to the end at the perfect moment.
I think you brought me there successfully.
With a great list of things that parents should want to have on hand to help their children homeopathically. So thank you so much for joining us. Thank you for being with me and sharing all of this with our viewers. I'm thrilled. And please tune in next Tuesday night at 9 o'clock for another episode of Healing Kids' Health Holistically.